Welcome to RWJBarnabas Health's Health Talk Show. I am Dr. Douglas Oshinsky of RWJBarnabas Health Medical Group. April is World Autism Month. Autism, or autism spectrum disorder, known as ASD, refers to a broad range of conditions characterized by challenges in social skills, repetitive behaviors, speech, and nonverbal communication. According to the Centers for Disease Control, the CDC, autism affects an estimated 1 in 44 children in the United States today. On today's show, we will learn more about the disorder, the signs and symptoms, and different treatment options. We are pleased to welcome Dr. Anna Malia Beckwith, Assistant Vice President of Ambulatory Medical Practices and Section Chief of Developmental Behavioral Pediatrics at Children's Specialized Hospital, an RWJBarnabas Health facility. Welcome to the show. Thank you, Dr. Beckworth, for being here. And for the studio audience as well as the community, can you just tell us a little bit about yourself, your background, and what got you over to Children's Specialized Hospital, which is an RWJBarnabas Health facility?
Yeah, absolutely. So thank you so much for having me. My background, I'm a developmental behavioral pediatrician. A lot of people don't know what that is. They know what pediatricians are, but not necessarily what a developmental pediatrician is. So just my background, I am a general pediatrician. We do our 3-year residency in general pediatrics and board in general pediatrics. But then for developmental, we do another 3 years. It's a fellowship program. And then subsequently we'll take a developmental peds board and then provide this specialty of pediatric services. The focus is on children with different abilities, disabilities, people will say, but I think of it as different abilities. So kind of a broad range of conditions. We see a lot of kids on the autism spectrum. We see children with ADHD, children with learning disabilities, anxiety, kind of a variety of conditions. Anytime there's a little bit of, difference that's causing challenges with development and behavior in childhood, we're there to support.
For the audience also, a lot of people don't know what Children's Specialized Hospital is. What is it and where is it located?
Yeah, it's I gotta say, pretty amazing place. So I'm from the Midwest, and in interviewing when I first came out several years ago to Children's Specialized, it's a unique organization. So over 130 years old, the focus of Children's Specialized has been to provide specialized pediatric care to some of the kind of crises of the time that are impacting children. Early on, tuberculosis, polio, that was, many, many years ago. And then there was a big shift in focus in the last 50 years on developmental disabilities and autism, and a real expansion of outpatient services to serve children with various disabilities, including autism. So currently we have 15 locations across the state of New Jersey, and great relationships with our RWJBarnabas family, and are looking forward to be able to serve children in a really special way, because it's, again, for these conditions, it's sometimes very hard to find what you need all under one roof.
So now let's change the subject. We're going to go over to the autism spectrum disorder. What is it? Define it if at all possible. Explain it, because that's not a term that most people actually understand.
Yeah, I know. It certainly can be confusing. So the diagnosis of autism or autism spectrum disorder, we consider it to be a neurodevelopmental condition with signs and symptoms that present in very early childhood. What we describe is really a pattern of social skills and behavioral differences. In order to qualify for the diagnosis, we use a specific set of criteria. There's a big book that has them, the DSM-5. Those criteria include deficits in social communication and social interaction, So verbal skills, eye contact, social reciprocity, and the presence. So those are kind of the deficiency side, but then also the presence of unusual repetitive behaviors is another major part of the diagnosis. And that can take on different forms. The repetitive behaviors could be sensory related behaviors, rituals, routines, repetitive movements. So if you have both the social challenges, communication, social skills, plus the repetitive behaviors, that's how we come to that diagnosis of an autism spectrum disorder.
And the early signs of a child possibly having autism?
Yeah, our goal, our ideal scenario is if we can diagnose children before the age of 2, but that can be challenging. Some of the earliest signs and features, we look for things like deficits in communication, verbal skills, but communication goes well beyond just language. It also has to do with gestures, and a very important characteristic is called joint attention. Joint attention is kind of one of our first really valuable social communication skills. It's where, again, a parent looks towards an item with their eyes or with a gesture. The child will then look towards that thing, look back at the parent, assess the parent's response, maybe even mimic and, kind of mimic that parent's facial expression. And that's a major piece of communication well before we have language. So, very early work on detecting autism is looking at deficits even as early as 12 months of age in that process of joint attention. 15 months of age, we look at deficits in pointing, specifically pointing to request things, because that's communication even without language. And then by 18 months, not pointing to show your interest, not, using that point to draw the parent's attention to things. So those are some of the very earliest things we look for. The repetitive behaviors, those rituals, routines, repetitive movements, sometimes they can come a little bit later, but every child is different.
So walk us through the assessment evaluation process at Children's Specialized Hospital.
Mm-hmm. So the parent will call scheduling, let the scheduler know their concerns. The first step that we recommend is an evaluation with one of our developmental specialists. So the process, if they were seeing a developmental pediatrician, would be, I always explain to parents, it's a lot of talking and it's a lot of playing. So my goal as a developmental pediatrician is to get as much history from the parents as I possibly can about the behaviors that they're seeing in the home setting or in the daycare or school setting, and then to have time to work with the child. We do administer specific evidence-based tools. Those tools are play-based, but it helps us to better observe the behaviors and perhaps, be able to experience and see some of the things that the parent is describing. At the end of that process, which can take, quite a bit of time, we can come to the determination if it is appropriate that a diagnosis does fit those DSM-5 criteria, and then have a conversation, of course, about what do we do next? What are the therapies or the interventions to make sure that we're supporting the child in the best possible next steps?
So what parents need to really understand is a lot of times they're dropping their youngster who's, prior to preschool over to a preschool, class while they're going to work. Mm-hmm. And that preschool
Sure.
class person who runs it notices something unusual with the child. Either the repetitive motions, they're not interacting with the children the way they think they should, they may be lacking some social skills, and they point that out to the parent. And at that point, that's when the parent needs to start looking and discussing this first with their regular pediatrician, I assume?
Right. That's usually the first step. We always, recommend conversation with the general pediatrician, but really in parallel, the parent can reach out to early intervention services. So in, every state, birth to 3, that is a state provided service that the family can contact for further evaluation. And then, after conversation with the general pediatrician, where some additional screening could be completed, reaching out for specifically more of an evaluation with a specialist.
So we have a state-sponsored program that parents need to understand that they have access to.
Absolutely. And that's, every single state, it's a part of a federal law. So the Individuals with Disabilities Education Act mandates provision of early intervention services. It takes on different names in different states, but in New Jersey, if you just even Google New Jersey early intervention, you can get their phone number. You call them, they will initiate an evaluation process. It could be speech, occupational therapy, physical therapy. So the goal being to at least start some services as soon as there are concerns. Early intervention does not have a medical provider component, so they won't make an autism diagnosis in New Jersey. However, the goal really is in most of our recommendations is starting intervention as soon as there's a suspicion and then working on clarification of diagnosis.
So again, as a parent, you need to listen when the person at that preschool tells you that there's maybe something going on.
That's my suggestion. And I know that's not an easy thing to do, right? I mean, as parents, I'm a parent. You see your child in a certain light, and parents may see certain behaviors and things in the home setting that might not, in a more social setting, in a group setting with peers, certain behaviors might not be apparent that the parent might see at home. And it's not an absolute that there is, quote, something wrong, but I would say it is an absolute to look and see if there is something more that needs to be done. And it never hurts to, contact early intervention, speak with the pediatrician, and determine the next step.
Same thing as if the grandmother or the grandfather who's watching the child doing the daycare says the same thing, is we're not going to classify, we're not giving them a diagnosis, but it's well worth the evaluation.
Exactly. And, even when I do diagnose, which again is another, kind of takes the breath out of your lungs moment I'm sure for a parent, but diagnosis is, yes, it is a label and it is a tool to get certain services. It does not change who the child is. The child is the same child that came into the visit. This just puts them on the pathway to getting more of what they need so that they can be that functional, independent individual that the parent is wanting to, be able to provide them the resources for that. So, I always try to kind of get away from a hyper focus on label and more on this is a means to getting what we need. And I think sometimes in that perspective, families can be more receptive to that.
Again, it's not the labeling that's important. It's getting the services that possibly are needed that's important.
Correct. But I will say in our current system, for example, in the public school districts, if the student is enrolled in the public school district, in order to get certain services, it may require a medical diagnosis. Certain insurance providers, if we're asking them to cover, for example, applied behavior analysis, ABA, which is a type of commonly used behavioral intervention, the diagnosis can be very important, or you may not get coverage for that service.
So the child still remains your child, and no difference there. It's more of being able to get the services.
Exactly. I think that's really, I think, a shift in the culture of, autism spectrum disorders is that we want, there at times in the past, I think might have been certain, negative stigmas and things associated with it. This is just a difference. There are tons of people walking around in adulthood who were probably never diagnosed and may have struggled because of that. So this is the goal, is getting the services very early. And that diagnosis can help you do that.
So is autism spectrum disorder common, and are there different severities?
Yes. So unfortunately, we are finding it to be more and more common. So the CDC, they have this entity. It's the Autism and Developmental Disabilities Monitoring Network, ADDM for short. So they're really our best resource for monitoring prevalence of autism, because there has been such concern in the last 10 years or so around increasing prevalence. The most recent report actually came out in March. So they put forth a new number, 1 in 36 nationally is the current prevalence in New Jersey, 1 in 34. So it is a common diagnosis and seems to be becoming, more and more common. Why that is, there is still a lot of question out there about that.
And are there different severities?
Yes, absolutely. So, along with giving us criteria, the DSM-5 does provide a framework to diagnose severity. Again, in more lay terms, certainly there's different levels of severity. Communication abilities, intellectual and cognitive abilities, how much certain behaviors, repetitive behaviors might be impacting functionality. But in the structure of a formal severity classification, it's a level system, level 1, 2, and 3, with 3 being the highest level of support required. Again, I do explain to parents we might give that level of severity, but that can change, right? So you may get the initial diagnosis being a level 3, requiring a lot of support. And then once you get those supports, we can hopefully be able to move into less support needed and more independent functionality.
And just so that the audience knows, the DSM is this big, large book of all different diagnosis codes. And basically, it's to be able to, it's giving a definition with a code so that when you need to fill out an insurance form, you can fill out an insurance form with a code that goes into a computer.
Yeah, exactly. It just lists all medical diagnoses related to, developmental, behavioral, and psychiatric or psychological entities, all in one big book. The book does get revised every so often, so we're currently on DSM-5, and that was a shift. In DSM-4, there was some different terminology around autism, more specific autistic disorder, Asperger's syndrome, pervasive developmental disorder, not otherwise specified. When DSM-5 was created, they collapsed those entities to one term, which is autism spectrum disorder, or ASD. People often refer to it for short.
So what is the recommended approach to treatment and some of the treatment options?
Yeah, so I consider the diagnosis is the first step, right? And then it's really trying to individualize what that child needs based upon their profile of developmental and behavioral challenges. It usually will involve a team, and it really should. It's a multidisciplinary approach. Speech therapy will be a major component depending on the communication challenges. Occupational therapy will address fine motor skills, like handwriting, activities of daily living that may be impaired, and also sensory processing challenges. A lot of kids on the spectrum will have difficulty with receiving certain sensory input, or they may seek it out in ways that could interfere with their learning and other functionality. And then we also have a lot of, focus on behavioral interventions. So one I mentioned already, applied behavior analysis, ABA, is one type of behavioral approach, which really works on teaching those social skills and those behavioral regulation skills required for learning. I often tell parents that's kind of how we build the foundation of the house. We have to build the foundation before we build the rest of it. So if we want to be able to learn very well in speech or in OT or in the classroom, we have to know how to sit, to listen, to engage, to imitate. So those are some of those foundational behaviors that the behavioral interventions will focus upon with autism.
So again, a team approach, speech therapy, occupational therapy, behavioral therapy. Very important, and again, it needs to be done by the team so that each one can help each other in order to help navigate the whole autism spectrum disorder with each individual child.
Right. And I do want to also mention physical therapy may be a piece. It depends. Some of our children on the spectrum, they have comorbidities. They may have low muscle tone, for example, or motor impairments. The family piece, I do want to mention that because the parent is such a crucial, parent or caregiver, crucial component to all of this, because the therapy sessions will be, a short period of time. The parent needs to be involved in order to learn some of these interventions and carry it over to other times of the day. So really, we have to understand and value the role of the parent in this kind of very intensive intervention approach.
And are there resources to help the parents or the caregivers?
Definitely. I think that's where you find your team, and that's probably the first and most difficult step. Early intervention may be a good resource for the family from birth to 3 for their therapies. Partnering with a specialist with expertise in autism, such as a developmental pediatrician or a child neurologist, having the therapist in your corner, really, the speech, the OT, the PT, the ABA therapist, And that comes over time. But I find for a lot of families, again, as a developmental pediatrician, I get the honor to kind of be one of the members of that team that is there over the course of the lifetime to help them be able to problem solve and determine, what is needed at each juncture.
And can the child receive treatment at different locations throughout the state, or does it have to be at one place?
No, we do. We tried, again, we've got 15 sites. We try to get as many services to every single site for convenience, because again, if you have a child with a disability, traveling long distances could be very challenging for services. So, again, if we didn't have a service at a given site, we may have it at another site close to you. So some families will do therapies at this location, but they might see their developmental pediatrician at the other location. So we don't tie you to one specific site. We want to make it be convenient and doable.
Any research right now going on to help drive the treatment, the approach to different treatments?
Constantly there's, autism research is definitely every day you'll hear about new reports, different reports. One of, I would say, the common factors is not a new finding. The value of early intervention is demonstrated constantly. And what I mean by that is early recognition, early diagnosis, and then starting those therapies and services in order to help the child develop skills as early as possible while the brain is still so early in its development, while we have what we consider to be plasticity. So when we can get to that brain, even under the age of 2, ideally, but 2 to 3 years of age, when we can start to really work on improving their skills that early, we do see better outcomes of social skills, cognition, activities of daily living. So that's why that early period is really critical, and that keeps coming up in the research.
What happens if we delay and we start treatment later?
The other piece of that, the other side is it's not a hopeless situation by any means. And so I don't want any family out there to have the impression that if they didn't catch this early, that is not the case. These interventions will help across the lifespan. And when you mentioned the research, that's also kind of an area of research for autism that is relatively new and growing, is the young adult, the teenager, and how do the interventions that we have provided for them in childhood, how can that be modified or adapted to treat new social and functional challenges as they reach this new phase of life. And there is a lot of support that these interventions can be valuable, and even if they weren't started very early in life, at any point.
Which, again, very important, because unfortunately, everyone has different means, modes, and you may not have your child in a pre-kindergarten program, and you may not discover until after the child's gotten into kindergarten, first, second grade, that something really is going on, and that's when you have to start intervention.
Exactly. At any point this can be started, and at any point you'll start to see the changes. That's the point, I think, that is just that when you are concerned, start that process, because it can be a process. I would also mention some of our kids with autism, especially if there's high levels of verbal skills or high cognition, sometimes it takes a little bit longer to diagnose. It may not be just clear cut that very first visit, and we arrive at the diagnosis over time. So it doesn't mean just because we didn't start everything, under the age of 2 or 3, that we're not going to get a lot of benefit. And especially if you have that child who is very cognitive ahead, you may actually miss a lot of it because they make up for it by being so cognitively ahead. Exactly. And those higher, we consider it, people will say higher functioning, whatever that means, because they can still have tremendous struggles, right? But that can be the challenge, is that it takes longer sometimes to diagnose. And what we say is, as social demands start to exceed capacities, as you get older, there's a lot more expectations of how you can handle a conversation and what you can do in various social situations. So it is not terribly unusual that it becomes more obvious at a slightly older age in those kids.
Or as they're getting, if we're moving on from elementary school to junior high school and high school, especially now that they're interacting with if it's a boy interacting with girls, girls interacting with boys, there's a whole change in what behavior is noted, and that may bring out more of, that may make it them more ability to find that they've got the autism spectrum disorder.
Yeah. Well, and I think what you're raising is a good point. I mean, in an ideal situation, we're diagnosing it well before they are in middle school. But what I do see in some of my kids is that we haven't had major concerns. It's kind of, yes, the child has autism, but they're doing so well and they're not needing a lot of services. And then we hit a new level, a new functional time of life where there's different expectations. And that's where we can start to see sometimes an increased level of stress and new behaviors that start to present. So again, just being mindful at every kind of jump as we hit different milestones in early childhood and into adolescence, that can be a phase where we see more challenges and have to kind of revisit what do we need to do for them.
Again, boys going into sports and the sports bringing out some of those type of repetitive behaviors, inability for the social skills. Girls, again, they get into cliques and that may set things off. So each one of those steps in their growth can suddenly make it more obvious.
Right. And girls, of course, the girls can be in sports too. And, you know, what I would say is what we see sometimes, I mean, but that's a good example because sometimes, again, losing is a hard thing to do. No one likes to lose. And so sometimes for some of our kids, that really, though, the reaction and the upset at not having things go as they expected or how they were expecting it to go and not being the winner, you know, so that does highlight for some of the families when they really get concerned about what they're seeing with the behaviors.
And yes, I forgot, it is my mistake. Girls do sports. Girls soccer really is very important. I know. It's probably better than boys soccer. And girls field hockey is probably better than what the boys do also. So yes, it's the winning and losing can sometimes bring it out.
Yep. Yep, exactly.
And when they go into high school and they start math courses and they're not doing what they think they should do, that can set off those behaviors also.
Yes. And so, I mean, again, I think the spectrum is so broad. Our more impacted kids will have a lot of, you know, potential behavioral challenges or learning challenges in those early years. But I think, again, as time goes on, we're going to have more and more understanding about the broad other end of the spectrum and how that is impacting life at different major life transitions.
So what key messages do you want to leave our audience with about the pediatric autism services at the Children's Specialized Hospital?
Yeah, I mean, I'm proud of the place. It's really a pleasure to be able to work in an organization that has the focus on this particular population, which is very unique. You know, it's not just another piece of other pediatric services. This is the focus group. We want to serve our patients with different abilities to the very best. We are very focused on trying to make all of the needs be available within our organization. You know, if they need various therapies, having those available, specialists that are also involved in the care, so physiatrist or child and adolescent psychiatrist, in really even an environment that is autism friendly. We've done a lot of work with our organization, going out to other partners and helping them to better understand the potential challenges of a medical visit for an individual on the spectrum, and really creating an environment that is autism friendly and, you know, a comforting place for both the child and the family. So I think it's a great place to be, and certainly we are always striving to get as many kids seen as possible. So that's the big focus is serving as many children that we can.
Thank you for everything that you do at the Children's Specialized Hospital, which again is part of RWJBarnabas Health Facility. Thank you for everything that you do with autism spectrum disorder, and thank you for being as good as you are at what you do.
Thank you. Thank you so much for this opportunity.
That concludes today's episode of Health Talk. Please remember that the opinions expressed here today by our medical expert are not a substitute for medical advice from your own physician. If you need a physician, please call 888-724-7123. For more information about pediatric autism services at RWJBarnabas Health, please visit www.rwjbh.org/children specialized.